Now, a very another important topic is the giant cell arteritis. Let's start Bismillahirrahmanirrahim. So basically what happens in this condition, there is basically inflammation of the arteries. Large and small arteries are inflamed. So this is an inflammatory condition affects the walls of medium sized arteries lumen. Okay, ischemia of the tissues which is supplied by the arteries means there is the blood flow is reduced, so there is an ischemia. Compromised ischemia affects many parts of body like polymyalgia, rheumatica head often involved. When temporal artery is involved, it is called a temporal or craniarteritis. Means why we are calling temporal, because when temporal artery is involved, we called it basically temporal arteritis. The avascular disease primarily affecting elderly age 70, onset sudden pain headache initiated or exacerbated by eating due to ischemia or masticative forces. Sometimes when patient even eat, there is a severe headache pain. Blindness, serious complication, very important point. Pain, dull and boring in character, reaches a crescendo over severe days and remain constant. Temporofrontal skin scalp tender to touch means their temporal area, their frontal area, skin, scalp. Basically, pain. When you touch it, there is a pain on it. Okay. Patient feels unaware and suffers itching and stiffness of shoulders. There is basically the patient is not well. He suffers from itching, pain, and a stiffness of shoulders, hips. That is polyalgia rheumatica. Polyalgia rheumatica is basically the stiffness of shoulders, hips, and also suffer itching and unwell. Lethargy, weight loss, weakness, nausea. Temporal arteries occluded, pulse less and thickened, and tortoise means the temporal arteries becomes blocked, so there is no pulse. Then diagnosis, multiple temporal arteries biopsies means you will take granulomatous arteritis, which is called angina cell lesion, occurs sporadically along the vein. Skip lesions, basically ESR you will take, and C rector is rise, means C rector proteins are rise in this case. Your differential diagnosis in temporal mandibular disorders, it can be, and trigeminal neuralgia can be. Basically, increase the doses of steroids which you are taking for it. Now, this is basically giant cell arteritis or temporal arteritis. You can see here. You can see here on temporal area. Now, moving towards the tension type of headache. When the patient suffers from stress, so there's a muscle contraction headache, which is very common. You can see it nowadays. There is so much tension and anxiety that there's so much. You will see the complaint of the students. Even the students suffer from this so much. Pain, mild to moderate or bilateral, can be feeling of tightness, constriction, or pressure. Pain may affect the frontal again. This is now in this occipital and then temporal muscles also. Pain episodic in nature, chronic but not accompanied by systematic disturbance or neurological signs. Means it is not basically severe, or it cannot be accomplished by like eating, like nothing like that. Then there is neurotension again if patient has. Then precipitating factors is over work, means he is doing a lot of work, fatigue, emotional crisis, or menstruation. Many women actually passes from a lot of cluster pain or headache during this, during their periods. Tension type of headache does not wake the patient. Okay, does not wake the patient. Very important point. Basically, now avoidance of precipitating factors such as do not take alcohol, improve your sleep pattern during using relaxation techniques, stress cooperation strategies, give the analgesics, aspirin, paracetamol, NSAIDs. Caffeine containing drugs should be avoided because it can be harmful. Resistant cases has been seen, so you can give antidepressants, and cognitive behavior approaches you should do it actually. Can be worsened like this. Okay.